Hello everyone, welcome to Dental Subjects. Today we are going to talk about the facial muscles. Okay, its origin, insertion, actions, blood supply, nerve supply, and its clinical significance. Okay, let's get into the topic. First one is the Orbicularis Oculi muscle. Okay, as the name indicate, it is the muscle present around the eyes, right? Yes, it is the ring shaped facial muscle present around the eye socket and inside the eyelids. Okay, it is divided into three parts from midline to the lateral side. Okay, first the part which is close to the midline is known as the lacrimal part. Then the middle part is known as the orbital part. Then the lateral part is known as the palpebral part. Okay, this muscle origin is from the frontal bone and the frontal process of the maxilla and the nasal part of the frontal bone, medial palpebral ligament, and the lacrimal bone. Okay, it gets inserted into the skin around the orbit. Okay, mainly in the lateral palpebral raphe. Okay, its main action is closing the eyelids. Okay, either tightly or gently, as in blinking and or squinting. Okay, it gets its nerve supply from the facial nerve, that is the seventh cranial nerve. Okay, mainly from the temporal and zygomatic branches. The blood supply of Orbicularis Oculi is the ophthalmic artery, that is the branch of internal carotid artery. Okay, next, clinical significance. As we already seen that the Orbicularis Oculi mainly aids in closing the eyelids, right? In case it is paralyzed or weakness of this muscle causes the inability to close the eyelids. Okay, when the eyelids are open continuously, obviously it causes dryness and excessive tearing, and it leads to the dryness and keratitis condition. Okay. Next muscle is the temporalis muscle. Okay, it is the one of the largest muscle present in the side of the head. Okay, see the diagram. It is very broad and a fan shaped muscle. Okay, fan shaped is the key word to mention this muscle. Okay, its origin is from the temporal fossa and deep surface of the temporal fascia, and its insertion is in the coronoid process of the mandible and in the anterior border of the ramus. See the diagram. We already see it in the mandible class, right? Yes. Its main functions are it elevates the mandible and it retracts the mandible. Okay. Its nerve supply is from the deep temporal nerves, that is the branches of mandibular nerves, and the blood supply from the deep temporal arteries, that is the branches of maxillary arteries. Okay, any spasm or trigger points in this muscle can cause the temporal headaches. Okay, any weakness in this muscle leads to the difficulty in chewing and fatigue of the jaw muscles. Okay, next one is the Levator, Labii, Superioris, Anguli, Nasi. It is the muscle with the longest name. Okay. It is the muscle which is present along the eyebrows. Then it travels down along the corners of the nose. Okay. It gets its origin from the frontal process of the maxilla. Okay, above the root of the lateral incisor and the canine teeth. Okay, it gets inserted into the skin of the ala of nose and the upper lip. Okay, its main action is elevating the upper lip, dilating the nostrils, and deepens the nasolabial groove. Okay, it gets its nerve supply from the facial nerve, especially from the buccal branch. Okay, its blood supply is from the superior labial artery, that is the branch of the facial artery. Okay, next the clinical significance. The paralysis or weakness of this muscle leads to inability to elevate the upper lip or dilate the nostrils, resulting in a flat nasolabial fold. This is important. Flat nasolabial fold. Okay, and also reduced facial expression. This is the clinical significance of this muscle. Next one is the compressor nasaris muscle. Okay, it is the one of the nasal muscles. Okay, it is the paired muscle. Okay, it spans across the bridge of the nose. Okay, it gets its origin from the maxilla. Okay, above the cranial fossa, just below the medial nactus. Okay, lateral to the nose. It gets inserted into the skin and the alar cartilages of the nose. Okay, that is the dorsum of the nose. Okay, as the name indicates, his main function is the compression of the nostrils, narrowing the nostril aperture. Okay, it's also assist in nasal breathing by increasing the air pressure within the nasal cavity. Okay, its nerve supply is from the facial nerve, especially from the zygomatic and buccal branches. Blood supply is from the facial artery. Okay. Next, clinical significance. Paralysis of this muscle may lead to dilation of the nostrils and difficulty in maintaining the nasal airway pressure. Okay. It also plays an important role in snoring. Okay, and in the expressive facial movements. Okay, next one is the mesenteric muscle. Okay, it is the one of the largest facial muscle. It is very powerful muscle, rectangular in shape, located on the side of our face, right? It is the primary muscle responsible for the mastication, that is chewing of food. Okay, it is divided into two parts, that is the superficial part and deeper parts. Okay, mainly it got its origin from the zygomatic arch. See the diagram, it is the zygomatic bone, right? It gets its origin from the zygomatic arch, especially from the anterior two-third. Okay, it gets inserted into the lateral surface of the ramus and the angle of the mandible, as we already seen in the mandible, right? Mandible glass, right? Yes. Its main functions are it elevates the mandible and assists in the protrusion of the mandible. Nerve supply is from the mesenteric nerve, that is the branch of mandibular nerve, and blood supply is from the mesenteric artery, that is the branch of maxillary artery. Okay. Clinical significance, hypertrophy. Okay, the hypertrophy of the muscle occurs mostly in the bruxism patients. Bruxism is nothing but the teeth biting habit. Okay, then the spasm or trigger points may refer this pain to temple, ear, and jaw. Okay, any spasm occurs in this muscle, it causes pain in the temple, that is in the temporal bone areas, ear, and in the jaw areas. Okay, mesenteric nerve block is also used in some dental procedures, very rare procedures. Okay, muscle is the levator labii superioris. Okay, it is the facial muscle that is present below the eyes and stretching from the side of the nose and sits above the upper lip. Okay, see the diagram. Okay, it gets its origin from the frontal process of maxilla, especially near the infraorbital margin. Okay, above the roots of upper lateral and the canine teeth. Okay, it gets inserted into the skin and mucous membrane of the upper lip. Okay, its main action is the elevation of the upper lip. Okay, its nerve supply is from the facial nerve and blood supply is from the superior labial artery. Okay, its clinical significance: in case if the paralysis or weakness of this muscle, that is, it especially occurs in the facial nerve palsy. Okay, it leads to inability to elevate the upper lip, resulting in a flattening upper lip and decreased facial expression. Okay, next muscle is the levator anguli oris. Okay, it is the muscle, it is present just below the levator labii superioris. Okay, it gets its origin from the canine fossa of the maxilla. Okay, just below the infraorbital foramen. Okay, its insertion is in the skin and the modules at the angle of the mouth. Okay, its main action is also the same. It elevates the upper lip and the angle of the mouth, producing the smiling expression. Okay, this is very important. The muscle which is primarily responsible for smiling is the levator anguli oris. Okay, its nerve supply is from the facial nerve and blood supply is from the superior labial artery. Okay, clinical significance: any paralysis or weakness of this muscle leads to inability to elevate the angle of the mouth. Okay, and it results in a loss of facial expression and drooping at the mouth corner. Okay. Okay, this is the end of our class. We will see the rest of the facial muscles in the next class. Okay, if you have any doubts, please kindly share it in the comment section. Okay, thank you.